Alrighty, let's go. Today we're talking about panic attacks and panic disorder. So, there are times when anxiety becomes so overwhelming that it boils over. It is what psychologists call a panic attack. So, what is a panic attack? It is a period of intense fear or discomfort that is linked with a specific physical and psychological symptoms. Symptoms are related to clinically significant distress and create impairment in important areas of life, such as work, studies, family, or whatever the case may be. People with panic attacks often feel a pounding heart, sweating, shaking, feelings of choking, fear of losing control, fear of dying, numbness, and chills or hot flashes. It can happen quickly, often out of nowhere, and it peaks in intensity around within 10 minutes. So panic symptoms can be frightening in themselves, and some people respond to them with intense fear. So 1 in 3 people will experience it at least once per their life. And others will experience them over and over and over again to a point where they will change their lives to some destructive behavior, some dysfunctional way to cope with it. So panic attacks are intense bursts of anxiety that often come out of nowhere, as we said, though sometimes they can be triggered by specific events or specific scenes. About 28% of people who experience panic attacks have them only occasionally. Others have them so regularly that they end up changing their lives to try to prevent these panic attacks. So that's the nature already of a panic disorder. So when we talk about panic attacks, we should understand if it's just panic attacks or it's already a part of a panic disorder. A panic attack itself, it's not a disorder obviously, but if it happens frequently and the person is in constant fear of having more and more, so that's when a diagnosis of disorder can be made. Surveys suggest that as many as 7% of people in the United States will meet criteria for a panic disorder at some point in their life, but not necessarily it will happen to them. Like many disorders, panic disorder tends to develop in late adolescence at the age around 15. It is more common in women as well as in racially marginalized groups, although the symptoms can actually vary among different groups. Panic disorder is not as common as some of other anxiety disorders, so about 59% of those with panic disorder will seek treatment for it. So, why do panic attacks happen? The biological model suggests that poor regulation of the fight, flee, or freeze response occurs in people with panic disorder. This means that panic attacks are more easily triggered in people with panic disorder. Neuroimaging studies show distinct differences in people with panic disorder, especially in the areas of the limbic system, such as amygdala, hypothalamus, or hippocampus. How do we treat panic attacks and panic disorder? Some early treatments for panic disorder symptoms are normally focused on medication that increase the availability of neurotransmitter norepinephrine in the locus coeruleus. More recent evidence points to a brain circuit that connects a number of structures, including amygdala, hippocampus, hypothalamus, central gray matter, and the locus coeruleus. It is a kind of panic circuit. Medications such as alprazolam, Xanax, and other benzodiazepines can be helpful, but they aren't used as often because of their side effects, such as dependence and grogginess. According to a psychodynamic theory of panic attacks, symptoms of panic can develop from unconscious fantasies and conflicts, especially those that feature anger and aggressive feelings about important attachment figures, such as parents. Some people feel overwhelmed by anger at these important attachment figures. So, since these attachment figures are often part of what creates our sense of morality, this anger is pushed into the unconscious and experience panic. So, instead of anger, people with panic disorder experience fear, which is much less threatening toward their attachment figure, right? So, why would you be angry at your parent, at your mom, at your dad, right? So the goal of therapy is to recognize this anger, these angry feelings, and try to resolve them. Okay? The main type of therapy is called panic-focused psychodynamic psychotherapy. Unlike traditional psychodynamic psychotherapy, it has specific amount of sessions, so it's 24 sessions twice a week for 12 weeks, right? When we talk about cognitive behavioral therapy, in the cognitive behavioral perspective, people who have symptoms of panic attacks, they're incorrectly interpreting the physical events in their body, like their heart rate or their breathing patterns. They interpret even slight changes in those sensations as dangerous, and feeling the worst, they begin to hyperventilate and then believe that they are in danger when in reality they are not. What's more, they believe their psychological sensations are very dangerous and uncontrollable. So during treatment, what do? We help them to analyze their thoughts and interpret them in a more adaptive way. There is also such thing called anxiety sensitivity. It is a tendency to interpret bodily sensations as evidence of harmful symptoms. So if we reduce this sensitivity to their bodily sensations, it can be helpful. How do we do that? So normally when a client comes to me with such problem, I always start first of all to help them understand that they are misinterpreting body sensations. And I help to more accurately interpret their body's reaction, especially during stressful times. So I teach some relaxation techniques, some distraction even techniques. They can help squelch the early signs of a panic attack before that becomes too great. Okay, so what else? A typical CBT treatment. Let's talk about this. So it consists of 12 sessions. One such treatment is called Panic Control Treatment Protocol. In it, clients learn about panic attacks and their typical issues, causes from the cognitive perspective as well. And as also they learn how to track the symptoms. So recognize the triggers and take helpful actions like relaxation and meditation. Therapy may even include attempts to trigger panic attacks, to show clients techniques to calm themselves and to let them practice putting themselves into situations that are bound to set off an attack. So 2 of 3 people who use CBT for panic have become panic-free by using these techniques. So CBT techniques are found to be as effective as medications such as benzodiazepines for panic disorder, but without some of the disadvantages. And other studies have discovered that most clients treated with CBT, they found symptom relief after 12 weeks. And some studies even reported that many of clients hadn't had a panic attack or symptoms of a panic attack 2 years after treatment. It also would be very useful to find out what happens in your day-to-day life. That I always ask clients about it. Sometimes they would bring to the consultation that they see some fearful and anxious dreams. Normally that would be some nightmares, very often would happen to them. But anyways, that's the dream that our subconscious, right? And you should deal with that, because that when you have a panic attack, that already means that it's not just like you have some fear or you having an anxiety. You have it to such extent that it's already panic you, it already attack you to this extent. So obviously it is a critical thing, and it's better to work with specialist. When you understand that you already started that process of an attack and you can anticipate that, you should start distracting yourself. One of the techniques would be, if you're in a room or if you're in some event, try to pay attention at least to 5 things in that room. Try to describe them to yourself, what color they are, what shape they are, how we can use these things, 5-6 things would be already useful, so we distract ourselves from that. In general, we would be working with all this story. If you have such problem, or maybe you had such problem, please let me know in the comments how you used to deal with it. And that was it for today. Thanks for watching. Bye bye.